Regenerative therapy is the future of medicine. That and nanotechnology and targeting structures and gene therapy and I started with regenerative therapy 20 years ago with the treatment prolotherapy. Then 10 years ago, I learned about platelet-rich plasma in my trip to Europe, and I've been using that here. So the natural next step is stem cell therapy. All those treatments with regenerative medicine, they work to attract stem cells and tell the stem cells what to do. So that was really just the next step in the evolution of what works out there. Unfortunately, most insurance companies at this point are not covering some of the regenerative therapies. They consider them new. It often takes 10 or 15 years to get a drug to market. It's the same thing also with a new technique. It could take years for something like that to be covered by insurance. Right now there probably isn't a sports team in the country, whether it's collegiate, college, or professional, that are not using these types of techniques on their athletes. So we know that they work, and the way to incorporate it in the practice is training and experience. So like I said, I've gone to courses, I've seen some other doctors using the techniques, and you learn how to do it, and then I bring it back into the practice. We have a laboratory here in the office. We are certified by the state for doing these things. We also have a certified operating suite here, and this is some of the machinery that we have here to do these techniques in, and that's what it takes. It takes the right training and the right environment to be able to do these things safely. 3 to 4 years, we're going to see some insurance companies starting to look at these types of things. We've spoken to the insurance companies about it, and I think they're starting to see some of the results out there. The research is getting very strong. There's hundreds of articles out there now if you do a search in the world literature on the use of these treatments. And quite frankly, we're looking at the future of medicine and cost containment and all. And if they're smart, they're going to do things that work. I mean, why spend $200,000 on a treatment? Let's just pick hip replacement, for example. When you take the cost of the surgery centers, the hospitalization costs, the cost of the equipment, the rehabilitation for months afterwards, and things like that, inpatient and outpatient rehab, it could be $250,000 in costs. And with the treatment of these types of biologicals that we're using, the bioregenerative techniques, for just a fraction of that, you can get somebody happy and functional and keep them that way for for many years without having to worry about that. Also, the complication rate of these types of treatments are practically zero, whereas some of the other surgical techniques, you have to worry about infection, you have to worry about the recalls of the equipment after it's already in your body. Some pharmaceutical company wants to tell you that, oh, by the way, we got a recall on that hip replacement. So you'll never see that with with the biological therapies.